any of these, you know that, oh, it might just be labor, and you should quickly get to the hospital. So I think apart from all of this, every woman should be advised to register and get seen by a doctor who knows what to do. Okay, because most of these things could easily be wrapped up by some of the routines that are done, to pregnant women when they are, when they go to the hospital for antenatal care. They get to check for, the common killers, okay, of women when they are pregnant. Okay, so they try to check things around blood pressure because it could be complications around blood pressure. They get to check the woman's urine, weight. They do all of those checks, and then of course they get to check the baby. The baby is growing well. Of course they check to see whether the blood level is good and stays so throughout the pregnancy. So once a woman does that and is in that care and gets checked regularly, it's very unlikely that there may be any of these issues.
So please, I'd like you to tell us who exactly is a candidate for preconception care.
Yeah, preconception care will be that care that you give to a woman who is planning to be pregnant. Okay, because it's been found that the condition which a woman goes into pregnancy determines to a large extent, the outcome of that pregnancy. So a lot of women may just be there and they have some, issues. Sometimes they don't know. But by the time they are pregnant and the baby is in the picture, those issues have a way of, complicating things. A particular group that I would like to mention here will be women that have medical disorders. There are so many women who actually are ill, they are on some treatment for certain things. Maybe you have a mom that's diabetic. Okay, such a woman should be And indeed, most people, there are those who even advocate that, that any woman that is trying to get pregnant or has not gotten pregnant or has any concerns about her health should try and see a doctor about it, because quite often you get to discover a lot of things that you deal with. But by and large, it must be stated that every woman who is trying to conceive, who is planning to have a baby, should be on a certain vitamin called folic acid. Okay, because that vitamin, prenatal folic acid, has been shown by by evidence to prevent the woman's baby from having abnormalities, okay, like neural tube defects or any of those malformations that may even lead to a miscarriage or may lead to an abnormally formed baby. Okay, so every woman should be on prenatal folic acid. Any woman trying to get pregnant. These are some of the things that can be done. It's easier for a woman who is trying to conceive. It's pretty much easier for that woman, because the woman will be seeing her infertility doctor. So the fertility doctor will probably have dealt with most of the issues, okay, that may have been. But for those who just consider the thing should do for you to get to see a doctor as soon as possible, very early in the pregnancy, before things change. Because when things change, there are certain things that may change later on in the pregnancy that may make people picking up problems a bit difficult. The babies get to form almost every part of their body in the first trimester of pregnancy. So you must ensure that you don't miss that window, because if you get to see a doctor much later in pregnancy, a lot of things could have happened that the doctors can do nothing about. So if you getting pregnant, you're pregnant, you should try and see a doctor. Have the pregnancy confirmed, and have the pregnancy confirmed by way of doing a scan. They will take a look and know that the pregnancy is properly sighted. Sometimes, I think I should chip this in, sometimes you may have pregnancies developing abnormal places, and you call that ectopic, and it could be dangerous. A woman could die from it. Ectopic is a form of a miscarriage anyway, okay? But it's just that the pregnancy is not formed inside the womb, it's tube, and because it wasn't meant for a pregnancy, so grow any further, so the woman gets to miscarry. But the miscarriage of ectopic pregnancy can be dangerous because it could cause internal bleeding in the woman that's pregnant. Quite a number of women, especially in the developing part of the world, have lost their life. So early pregnancy, try as soon as you know you've missed a period and maybe you've done a pregnancy test and it's positive, try and get to see a doctor so they can check up on you, confirm where the pregnancy is located, and then do some health checks and be sure that you are in a good condition, to go on with your pregnancy.
Here's one last question. Now, if I want to see a good OBGYN, I know where to go. If you want to refer someone, you know where to go. But there's a challenge of what's this thing called now? What they describe it? The information is not necessarily widespread. It's not like you can go to a catalog and then flip through and then you see ratings of different ratings of different
Yeah.
consultants.
Yes.
The reason why I'm bringing this up is because I have had conversations with people where they're recounting their miscarriage experience, and they're just, every single sentence is the person describing to me mismanagement. You know, certain things in their care were not necessarily done properly. Um, and I mean, even my family members, I always say, when you walk into a consulting room, engage. You know, some people can come into your consulting room and sit down, and then you're the one doing the talking. They're not really contributing so much. You're not asking so many questions and all that. So, what are the um how does a mom, how what are the things a mom should look out for if she's had a miscarriage and then she's had an evacuation done? How does she know that it was done properly? What are the things that she should be looking out for, or should be worrying about?
Okay.
Mm-hmm.
Uh, well, it may be difficult to really, because I want to take your first question first. You know, it may be
Okay.
difficult to say who good OBGYN is, and I think every woman. Every family has that duty to seek um, to get to seek good health care, because not necessarily because somebody has a name, is maybe Professor so and so and all that. I think there are certain things that every woman should look out for. In our own environment, it may be difficult to say, okay, you're going online to check up on some guy, person's CV and what the person has done. May be difficult because I think the Medical and Dental Council is trying to develop that, and we hope that in the nearest future we may have, people's qualification, on the MDCS database, that patients can just go and check up on, what the doctor has. But I think that every woman should, first and foremost, eh, look at the individual. What level of training does this person have? Okay, because see, if you're dealing with a pregnant woman as a general doctor, it's different from you dealing with a pregnant woman as someone who has specialized, in that field. You know, Specializing means you've probably, you've put in some more years. Of course, you've seen a bit more, and when some of those ones that may be difficult for the generalist guy will come up, you should be able to deal with it. Apart from that, it's also very important, you know, how equipped that facility is. Because you can have a very good OBGYN if the person doesn't have a well-equipped center. The person may not be able to do anything. I'll tell you, in pregnancy, you're dealing with the life of, the life of the mom and the baby. So you must have a very good center with equipment and staff
And
that
ultrasound scan.
can deal. Yes, ultrasound
Thank God.
scan, it should be basic, it should be everywhere. It shouldn't be, and indeed, try to look out for an OBGYN guy who can
You
do a
can
scan right there for you. I think it's an advantage. I don't believe an
yeah.
OBGYN should be. what your qualification. I don't mind. I'll tell you because I believe it's your right. And indeed, if there are things that I'm telling you and I sense that you are a bit in doubt, I even encourage patients to take a second opinion. I love it because you see, by the time you go get a second opinion and you know that, oh, this guy was right, you will come running back. So it's for me, it just makes the
Origin.
okay, and and it makes the whole process better, and outcome can only be excellent in that kind of situation. So about the healthcare professional, the woman has that duty, and her husband too. They should try to look out for not just the, the professional, but the facility, because sometimes you have some very skilled guys in some very horrible setups, and you can't really support some.
Yeah. Yes.
Even in very good hands, that occasionally the whole process.
Hello. Uh-oh. Dr. Ekanem was giving us some very important information. That's just the last question he was answering. He was just talking about what to expect after an evacuation has been done. I think it was network. Let me just try and see if I can get him back. So it's very, very important really for moms to know what to expect after a miscarriage and after they've had an evacuation done. I'll try and get, if I can get him back on, I'll try and get that information and then I'll put it up as a post. I'll put it up as a post. But thank you so much, everyone who's joined in. I'm going to try and see if I can get him back. I'm trying to see if I can get him back on. I hope it's not a permanent problem. But thank you so much, everyone. I'm going to go off and then I'll try and come back on again. Thank you very much. Yeah. Thank you, sir. I think the network was bad.
Yeah, I think so.
We couldn't hear you at the end.
Um,
Yes.
okay,
Please, just
you,
that last nugget of information you were giving us on post evacuation care.
yes, post evacuation care. Yeah,
Yes.
we talked about the fact that the doctor should be able to discuss the options, okay,
Okay.
with the woman. Okay, we should be able to. Basically, we have three options. We have the option, like I said, of you just waiting and hoping that everything will come out, of the woman's body, maybe like menstrual period. Okay, you call
Okay.
that expectant approach. Okay, it's not very popular, especially when the pregnancy had gone beyond a certain age, where you feel that certain parts of the baby have started forming. Okay, so we typically would use it for maybe very, very early miscarriages, maybe 4, 5, 6 weeks, or those ones that may just come out as blood. If you check and on ultrasound and there's little or nothing in there, you could adopt that approach. Okay. However, if you adopt it in miscarriages at later stages, it could get complicated. It could take a bit too long, okay, for everything to come out. And of course, you just delaying this woman's distress and all that. So really not very popular, but that should be discussed. The other options are the options where the doctor, excuse me, may have to do something about, meaning you intervening. So you can intervene either with the use of drugs or you can intervene with your using instruments. Okay, some things into the woman's body to try to bring out whatever was left in there. Okay, right, because miscarriage means that a pregnancy has been lost. Sometimes part of it is lost. Okay, and I mean, you need to go get out the remaining, okay, so that the woman can be free. That womb can be free for her to get pregnant again. So you can do that with the use of some drugs, and the doctor should be able to discuss that, okay, with the patient, the chances, okay, and the complications, all right, that may occur, with the use of any of those options, okay. And I don't believe you should just take the woman to theater without telling her, what she's likely to expect, especially if she's going to be put under anesthesia. Okay, she should be able to talk to the woman, inform her of what the procedure is, and give her those options. Let her be able to make some decisions. Let her could do that in very good hands, okay, where everything is handled well and not overzealously, because sometimes you do have some very inexperienced practitioners go in there trying to evacuate, meaning you clean up the remaining stuff in the woman's womb. They will go and get very overzealous, because if you get very overzealous, you could actually be scraping off some normal parts of the woman's womb lining, and then you end up giving her some scar tissue that may now make it even more difficult for her to get pregnant subsequently. How she usually would know this is by the time she's supposed to see her next normal period, it comes and is very scanty, and she begins to probably not have very scanty menstrual flow. Those could be some signs that there may have been some damage done during the evacuation process. Okay, but apart from that, in the very acute phase that you're trying to do whatever you're doing, she could bleed a bit excessively. Okay, and all of these in very good hands. Doesn't happen. Okay, and if at all it happens, it's taken care of. Okay, apart from bleeding very heavily, there could be issues with her constantly discharging, having abnormal discharge, sometimes a bit offensive, okay, malodorous, just coming through, and then, that typically will suggest that the whole procedure got infected, okay, and it could be very dangerous. Indeed, it's interesting to note that complications, okay, of miscarriages and mismanagement, okay, rank among the leading causes of maternal death. You have women who have gone through all kinds of scenarios, in the hands of people who don't know what they're doing. They don't understand how the womb of the woman is positioned and how to go and do what it's supposed to do. Okay, so they just go scraping things. Sometimes they go into wrong areas, and they could cause more problems, okay, to women. So it's important, okay. First, the woman has to be on the lookout for the quality of the healthcare. I will always say, because as a healthcare provider, you should be on top of your game, and you should be able to tell the woman what you can do, offer the woman, the options, and let her make her decisions. So she should be able to look out for the quality of the caregiver, and then the facility. Sometimes you walk into some places and the place is just not good enough. Okay, you can sense some of these things by the things you see around. So one is not here to talk about, but the woman should know and go to proper places, okay, for these kinds of treatment to prevent the complications that may happen from management of miscarriages. Okay, one of the complications could be the early ones, like we talked about, excessive bleeding, okay, or maybe she could get an infection, all right, or we have late complications, like you have scarring, and then she now ends up with infertility. Someone who would get pregnant easily, now struggling, to get pregnant. So these are some of the little things that, could happen.
Thank you so much.
My pleasure.
Thank you so much, Dr. Ekanem. Yeah,
My pleasure.
I'm sure this is going to be so helpful for a number of moms, because you just need to understand. You just need to understand everything around miscarriage, around pregnancy loss, and what to expect. I think it will also help emotionally as well for them. Thank you so much for your time, sir. Thank you very much.
It was an
Yeah.
absolute pleasure.
Thank you,
you.
sir. Thank you. All right. Thank you, everyone, for joining in. And like I said, the replay will be up for 24 hours. Thank you very much. Bye. Good night.